Hi, how are you?
Unpacking.
You're unpacking. Did you move?
Yeah, I got my dining room table today from Amazon, and I also got my another desk from Amazon, so I'm in the process of assembling it.
Did you tell me this like a week ago that you were gonna be moving?
Yeah, so when the semester first joined, I was in Melbourne. I was in a hotel, and then
Good.
I moved to Lancaster a couple weeks ago.
Okay. Yeah, I remember, I just remember a student telling me that they were moving and I could not remember who it was. But are you happy with where you're living now?
I like Lancaster. I like my apartment. It's definitely quiet. In the morning it's a little loud because of the kids, but that's what you get when you're in an apartment complex.
That's true. Do you live on the bottom or top floor?
I'm on the
Where do
second
you live?
floor.
Second floor. And so do you have a floor above you?
Yeah, I don't really hear them. They're really quiet. Same with downstairs. So
Okay. Well, that's cool.
yeah, I went to my first
Honest,
farmers market this week, so it's kind of interesting.
I honestly, I don't think I've ever been to Lancaster. I haven't lived in Pennsylvania very long. And yeah, I haven't, I just haven't traveled. I think, this summer I want, for now living, I've been to Washington DC several times because when I lived in Idaho, my family was already out here for years. And so I would travel back here like about once a year. And the majority of them live in that area. So I got used to that, but I've never, anywhere else I've never been to out here. I'm thinking there's things that I'd like to see, like Ocean City and New York City. And I'm like, I need to start traveling.
You should.
I,
I mean, you gotta start somewhere. I've been to 32 countries, and each country is
wow.
so different.
I've lived out of the country. I lived in Japan for 17 months. But that's as far away as I've ever traveled. And I only did that for those 17 months. I've never been to, actually, I've been to Canada, but that was for a school thing when I was in graduate school. So yeah, I mean, I've traveled a little bit, but I don't travel for fun. And I'm thinking, while I'm this close, I really should, because you don't know where I'll be tomorrow.
Yeah,
Yeah,
definitely. I mean, I've had some of the most best. I had the best experiences in the most unexpected places.
awesome. I never expected to move as much as I have. Like, I've lived in several states. I was born in Utah, and I've lived in Idaho, Utah, Arizona, New Mexico, and Minnesota, Maryland, and here. And I didn't ever plan on moving that much. As a child, I didn't ever foresee something like that. But I don't regret it now. First, any questions or concerns? I know that at least one of you has emailed me this afternoon, and I have not checked my emails. I've been involved with another adventure, and I'll explain what I've been involved in. So I have a student who had me for 121 last semester, and she did really, 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 really well in the class. And she's now got me for 122. And Zena won't know who this is, because this person, there's several students in there that had me for 121. But she made the comment to me this last week that she missed the chapter practices that I used to give students, and that they would really help her. And that she struggles with a learning issue, and doing those really helped her. And, you know, first off, when she told me she had a learning issue, I was like, no, you don't. But then I'm reading a book about the evolution of autism, and I'm realizing that you don't know what's really going on with most people all the time. And the reason I'm bringing it up with you is I've decided to do something, because she and I ended up talking on the phone for a little while last night. And what I'm doing is, last semester, and I'll show you really quickly. Last semester, in addition to the smart book assignments and the chapter quizzes for every chapter that we did, I also had them do a chapter practice. And what it was on McGraw-Hill Connect, a pool of questions, just like your quizzes are, but a lot more questions. And I took it out this semester because I felt like if you feel like you have a lot to do in lab, they had a lot more to do in lab last semester. And I felt like I kind of overloaded my students. And so I felt like this semester I wanted to come back. But talking with this student last night, she was saying, I missed that. I want that. And so what I'm doing is I'm setting those up.
Yeah, I'll make a spot for
But
you.
they're extra credit, because that's the only way that I can think to do it. You know, I don't have it in the syllabus, so it can't be mandatory.
I got a question. Have you noticed any success with like a certain type of like note-taking method? Because it seems to me like I can see the material and I can understand the material, but it's not clicking in my head. Like, do you have like?
Well, you know, most students don't tell me about their note-taking. That's the thing. So I don't know. But I will tell you that this works for her. And, you know, because she's not here.
Why?
Well, no, I'm not going to tell you. I'll just tell you she deals with what you would consider to be a learning disability. I honestly don't think it's a learning disability. And not that not to demean what she deals with. But I explained to her last night that I honestly think it's a strength to her. Because if you look, I've been reading this book about the evolution of autism. And if you notice, we're seeing it more and more in our society, that we're seeing a lot of autism. And a lot of autistic children are coming from very, very intelligent parents. And they see it. And for example, in the Silicon Valley in California, there's an epidemic of autism in their children. And if you go and you look at history, you look at, see, here's some good examples. The person who actually discovered Asperger's, the children that he worked with, he called his little professors. Because even though clinically they'd be diagnosed with the Asperger's, if he started teaching them and allowing them to work in the areas that they were really interested in, they would amaze you with what they'd learned. And Thomas Edison had ADHD. And his third grade teacher told him that he would never amount to anything. And Albert Einstein showed all the symptoms of having Asperger's. And in this book, he mentioned several others. There's a professor who I've met twice, and she's a professor at Colorado State University. And she's very obviously autistic. And if you look up the name Temple Grandin, she was also ranked last year as being one of the top 10 professors in the US, college professors. And so when what the argument in this book, and he doesn't really touch on it, but I've heard it more than a few times. The argument is that autism is actually an evolution of humans. We're never going to get rid of it. And we really shouldn't. And we shouldn't try to, because first of all, it demeans people who have it, to think that you're going to try to get rid of it and that they're a mistake. But if you look at some of the most intelligent people in our history, many of them were autistic. And there's a lot of examples of those who were autistic. And so when she mentioned to me last night about this and, saying it's learning disability, I don't honestly, I told her I don't believe it's a disability. I think it's that you think differently. And my idea and my argument to her was play to your strengths. And was it Penny who asked me the question now that I gave you a very long-winded answer and really never answered the question about note-taking?
No, it was me, it was Lauren.
Lauren, what I would do is what has worked for you in the past, note-taking wise?
I usually write it down and then look at it. But now that I'm in a biology type class, I can't just write everything down because it's I also have to draw, and I can't draw a cell. I can't draw a cell. I can't draw the insides of the cell. So that's what I'm having trouble.
You know what? One thing that I would mention to you, especially when we start doing the anatomy, is I would draw. And even if your drawing is crap, drawing on a pathway, you will remember it. My anatomy professor, a major part of our exams, my graduate anatomy course, and I took head and neck anatomy with him and gross human anatomy, and they were both graduate level courses. Half of our exam was drawing things out. You don't have to be a great drawer. One thing that you may want to look at are these, and let me find them for you. There's two suggestions I have. One is this.
Are you talking about the coloring books?
Yeah. Have you ever looked at these?
I have, but I wasn't sure if they were considered accurate or if they were good.
They're accurate. They're very accurate. This one I actually have here on my shelf. I actually have this one too here on my shelf. I got this one because it was one that was highly recommended by my first anatomy professor. And so I got that one. It's more information than we're ever going to go into. However, as you color, you're thinking about it. The textbook that we had with him that we worked through in lecture was a coloring book. And we would sit there and color during lecture. And I am not that high up I'm a pretty beginning professor. I've only been doing this for a couple of years. And I'm not at a point where I can cause uniform changes within schools.
Mm-hmm.
But this is something I would highly recommend for anatomy classes. The other thing is there is this. There's a physiology coloring book. There's actually, if you have to take microbiology, there's a microbiology coloring book. I may have that one too.
I don't think I had to take the microbiology courses because I'm in the pre-cardiac sonography program. But
Right. But this is one because if you're going to be doing physiology this semester and next semester, or 121 and 122, this is another one to consider.
okay.
And on this same idea, I will, with what you're saying, I will make those practices. And what they are, I'll show you the one that I did for this class, for 122. I'll just show it to you really briefly.
I do want to mention that I took a special psychology class at my previous community college. And in the community college textbook that I was reading, it said that individuals with ADHD was the most essential group for human evolution back when we were hunter and gatherers, because the 88 people with ADHD, they're just like, okay, I'm tired of this spot, let's go to the next spot. So
well,
a lot of times,
yeah, I believe you. One thing is I think ADHD is on one end, very far probably on the spectrum of autism. ADD is also on there. Pervasive developmental disorder is also on there. A lot of these disorders that we're seeing more and more coming out we're seeing them more and more and more. What is that saying about our society? It's not coming from the vaccines. The study that said that it was coming from the vaccines was stupid and had no controls. And he also falsified a lot of his data. But we won't say anything. I think you're right. And I don't know so much about the hunters and gathering stuff. I'm not a psychology person. I like learning about autism because I do, my interactions with people who are autistic and my interactions with people who have ADD and ADHD, they are sometimes the smartest people you will ever meet. And I have a good friend who is a professor at the University of Michigan right now, who was diagnosed as being ADHD when he was really little. But let me show you these practices. So these are the ones that I set up for 122. And it's only 5 points. And it's a lot of questions for 5 points, but it's extra credit. And I selected, I go in and the whole pool of questions that the book allows me to get, use its whole question pool. And I tell it to give, and so 174 questions for chapter 18 is how many questions I was able to use. 64, and then I tell it to randomly give my students 64 of those questions each time they do it. It's only worth 5 points, and it will probably take you easily maybe an hour, maybe an hour and a half, maybe 2 hours, depending on how ready you are going into it already. However, for her, this student that I had the conversation with last night, this is what she missed from last semester. And I think she got one of the top scores I know she got one of the top scores on the class. I know she did. I don't honestly remember exactly how she did, but I know that she did really well. And this worked for her. but everybody learns differently. Like you were saying, the ADHD, everybody learns differently. And what I recommend is play to your strengths. How do you best learn? You know how you learn better than most people. And like, you know how you learn better than anyone else. And if you'll give me ideas as to how you learn, if I can do it, I'll do it. There's a lot of things I can't do, like putting these together, just for the first 3 chapters we're covering in that class, took me almost an hour. And I can tell you that I don't have an extra several hours in a week. So it does take me time to put these together. But if they helped, I would do it. Do you guys want them? Because you're going to see some of the questions, maybe the same ones that are coming from your quiz, because there's only so many questions that McGraw-Hill gives me.
Professor Gessel, is there a way for you to like maybe not make it so long so then it's easier for yourself?
I'm gonna make it long. And the reason I'm gonna make it, it's gonna give you feedback, Christina, but I'm gonna keep it long, because if I'm gonna give you extra credit, I'm gonna make you work for it.
Gotcha. No, I understand. I just, without even the extra credit part, just if you gave us some questions and then.
But you don't have to do it all in one setting.
Okay, so you could do
And
it
you
on
have,
multiple
and
attempts.
sorry, Christina. What did you say?
I was just saying, so we could start and stop it over several.
Yes.
times. Okay.
Yeah, the way I'm not gonna round these scores up. So if you only do like 2 questions and they're only worth like 0.04 a point, I'm not gonna round you up a whole point. So I'm not gonna round these scores up. At the very end, I'll probably round them up because I have to do it at the end. But what I'm doing for this class, because your final is also cumulative, is that I made them, I posted them today. They're open for the students today, but they don't close until May 9th, which is approximately when the semester ends. And you have unlimited attempts, and something Christina brought up the other night is getting feedback. These are set up so that you don't get feedback after the first attempt, but if you do a few attempts, it does give you feedback afterwards, and it tells you what the answer is. Do you want me to do them?
Yes, please.
Okay. So there'll be extra credit, and yeah, this is actually the shortest one, believe it or not, because the other 2, I think the other one is 98 questions, and it depends on how many questions the chapter gives me. But you can also, it's going to give you an idea, and you might learn things that we aren't going to go over in lecture. Because I can tell you, we don't cover the whole chapter. But I will make them available, and you can do them or you don't have to do them. And use it to your advantage, because she said that it helped her. And it's unlimited time and unlimited attempts. And if you run into a glitch where it doesn't allow you unlimited attempts, let me know. And then I'll go in and I'll fix it.
Where would you be posting them at?
For you, Zena, because you're also in that class.
Uh-huh.
Did you see that email that I sent out? No, I didn't send it out. I didn't send it out. I sent it out about the case studies we'll be looking at on Friday. But bear with me here. Here's your chapter 18, Zena. It's right here. It's at the very end. And so I have it set up for chapter 18 21, and 19. So for the blood, the immune system, and the heart.
Okay, that sounds great. Thank you.
And I will, within the next couple of weeks, I'll get it set up for all the chapters. So I will do it for this class. Be patient with me because your class is probably going to be easier because I had them from my classes last semester and I can copy them over, most likely. But I will send out an email when I have them posted. All right, let's jump into tonight. Are there other questions before we jump in? So the lab part tonight is not going to take very long. And you'll see that I think the questions for Wiley, there isn't that many in comparison to what you've seen before. Bear with me and I'll show you how many. There's only one set. And it is $50 questions. And it looks like someone has already submitted one.
The lab we did for this week was brutal.
Was it brutal?
It was pretty brutal.
You know what?
I concur.
I agree with that as well. Yes.
It's the only time, most likely, that you're going to get a lot of histology, and it is important. You'll get some more histology, but not to this extent. You can ask Zena. Zena, are you seeing a lot of histology in 122 in the lab?
No, I think I'm getting it mixed up in my head, but I think it's AMP1 that I see a lot more than on AMP2.
We will stop. It's going to be brutal today, but then we will stop running into so much histology. What I want you to do is compare up the photos between the PowerPoints. You can also go online, and because there's lots of other photos.
I don't know.
Use your textbook also, because a lot of the pictures that they're using, they've got photos of.
I was going to say, Professor Gessel, I have the paper version of the lab book, and that was really helpful for me. So even though it didn't always have the answers, I was able to, once I figured it out, fill it in and be able to compare the questions from what was in the lab book were similar enough to kind of help me figure it out.
Okay. Let's jump into this. I want to, if we have a chance, I want to do some work with regards to lecture, because we had some technical issues the other day and it slowed things down. And last semester for my 121 students, I ended up having to skip a chapter and make them watch recordings, because in 121, we have to get through a certain amount of chapters. We have to get through all of the chapters that we're required to. And so if I can not have to give you a recording because I think they're boring as all get out, and I wouldn't be want to have to sit there and watch them. And I have to make them, and I think they're terrible. They're fine with the information, they're just boring. But so if I don't have to do that this semester, I'd really prefer not to. There were some other technical issues last semester that we don't have this semester, because I've gotten a little smarter with working with Zoom and D2L. So let's let's jump into this right now. And I do want your feedback if it's brutal, because what it's also telling me is where can I improve on it?
So it's not letting me log in for the Wiley lab exercises, part
Why
A and
is it-
B and C.
What
and
is
D.
it telling you?
It says assignment's not available. Your instructor has not made this assignment available yet.
Someone has already done it.
I have done it, but it's only A and B that I was able to do, the part 1 and 2.
It closed
But-
for me as well.
Are you talking about the lab exercise from last week or the lab exercise for tonight?
For
The C,
tonight.
Say it again.
So I'm looking at Wiley lab exercises, exercise number 6, parts A and B, epithelium.
All right, that was last week. This is the beginning of the PowerPoint.
Okay.
I can reopen that for you because it closed last night. And that's why it's not allowing you into it. Most likely. I can
I thought
reopen.
we were, okay, okay.
So last week we did lab exercise 6. If you follow the syllabus, we're on track with the syllabus. Well, last week we did lab exercises 6, parts A and B. And this week we're doing lab exercise 6, parts C and D.
Mm, okay. That makes sense because for me, it didn't let me do the C and D, lab exercise 6, C and D. It was saying it wasn't available. Your instructor didn't make it available, but I was able to do in B.
Are you able to do C and D now?
I was not, as of late last night, I was not able to. So I
Okay,
was
I don't, I think it opens at midnight. I'd have to go back and look.
Yeah, C and
Okay.
D is not open yet, is what it tells me.
Give me 1 second. Let me go and actually look at it. And then I can tell you. Because that's kind of important right now.
It's open for me.
It is, well, why isn't it open for everyone?
Which I don't know that I wanted to open it now.
You know, but you can open it multiple times. You can close it if you want to right now.
Okay, I'm gonna close it then. But it's open for me.
All right, let me see, what were the dates on it? Because I don't let it open really early. I try to have it open the day of lab. And I can't remember when I had it opening. Because I did this like maybe a week and a half ago.
For
So
some
let me-
reason, I was thinking that this would be like due on Sunday, not in the middle of the week.
Well,
I
I
feel
mean,
so bad.
because we don't have lab on Monday. What I'm trying to give you is a full week. Or at least a major part of the week. So I would prefer to do that rather than have everything due on Sunday because we don't, I mean, we have class on Monday, but this is lab. Would you want me to only give you 5 days to do it? Or would you like 6?
Obviously, I guess I misread the syllabus. I apologize.
It's all right. It's all right. Bear with me just for a second as I can't see anything.
I think I kind of misread the syllabus too, because I didn't do Wiley Lab A and B and it won't let me in. I thought for some
Well,
reason.
what I need you to do is send me an email and tell me
Okay.
approximately when you think you'll get it done and I'll reopen it for you.
All right, thank you.
You're
The
welcome.
same thing happened for me. I wasn't able to open A and B, and
When were you trying to do it? That's my question. Was it was it today?
I tried last week and I tried last night and then I tried again today and I wasn't able to get into it
Yeah, I
either.
had the same problem. I was
And
not
I
able to
emailed
get
you
in.
this because I had this problem. You never responded to my email.
Well, I get lots of emails, and if I don't respond to your email, send me a text. Because I may, at some point, it's you're sending it to me in the middle of the night, and I may get it in the middle of the night, even if you didn't send it then. I can tell you that I'm not awake in the middle of the night.
And then you graded me. You gave me a 0, and I emailed you again stating that I had a conversation with you. I told you.
Send me a text. If
Okay.
I'm not responding, send me a text. Because I'm not intentionally trying to ignore you. Just send me a text. Yeah, I'm not intentionally ever trying to ignore you. But it depends, I do teach 5 days a week. And so I'm not going to respond immediately. And if for some reason I've missed it, which people do miss emails every once in a while, send me a text. I gave you my cell phone number for a reason. Send me a text and let me know.
Just so you know, it is letting me get in right now. But
It is
yeah,
now.
I was able to get in. Yes, thank you for your
Okay.
help.
Okay. Because I can go back and look for your emails, but I can tell you that I have not received some emails that people tell me they're sending to me. And so if you send me a text, then I can go and actually search for your email. And sometimes they're not there. As I just had this conversation with a fellow professor earlier who said she'd sent me something, and I went back and I don't delete my emails from my school emails. And I never received what she sent me. So that's why I'm giving you multiple ways to contact me. All right. So it should be open now. That's what people are saying. And Ruby, you're going to make me crazy because I just took you out right before my class. I have a big dog here who's now decided she's not being paid attention to. Let me see if it's just me, so bear with me here. This isn't what I want. You're all right. Okay. So it says that it opened this morning at 12 a.m. And it will be open until next Tuesday at midnight. So lab exercise 6, parts C and D. So before we do this, quick review. What were the different types of epithelial tissue?
Boidal,
Cuboidal, and what else?
Squamous,
Squamous and
Columnar.
columnar. And how, so that was the way they're classified based on their shape. How are they classified by the number of layers?
You have,
Stratified.
Say it again, Kara.
I was gonna say you have simple, you have stratified, you have transitional,
Right.
and I think you have a non-keratinized. I don't
Right.
remember the second half of that part though.
Right.
So
Right. And let's see, what else can I ask about this? What were the basic functions of those types of tissues? And we'll see these more and more as we go through different body areas. We'll talk about specific types of tissue and where they're located. But what's the purpose of stratified squamous? What's the point of having it where it is?
Protection?
Protection, right. And so the bottom layer is actively dividing, the top layer is dead. Let's see, what else can I ask? What's the point of having simple squamous epithelium? Where is it found?
Isn't it like the top layer and isn't most of it dead?
No, that's stratified. That's stratified squamous. But why simple, meaning there's one layer and it's really thin? What would be the point of having one layer of really thin cells? The thinnest cells we have.
would it be to
Or-
pass like fluids through, like transport?
Yeah, for diffusion. Yeah, for diffusion, movement. What else can I ask? What is the point of simple columnar?
is that for heat?
Say it again.
Is it for heat to keep like insulated?
what about
Not really, that's more connective tissue or stratified squamous.
what about secretion?
Yeah, for secretion and absorbance. Absorption. A lot of times our simple cuboidal or simple cuboidal, simple columnar tend to be used for absorption through them. We talked about those tight junctions and how they make things force things to move through the cells rather than in between the cells. That's the point of the simple columnar and simple cuboidal oftentimes. Another reason, let's see here. Another reason, like I think someone said, was secretion. Your stratified columnar, stratified cuboidal, often they're secretory, they're in ducts. What about the connective tissues? What were some examples of connective tissues?
Bones and blood.
Say it one more time.
Bones and blood.
Bone and blood, right. One of them being the supportive connective tissue. What other, bone was one type of supportive connective tissue or structural connective tissue. What was the other type of structural connective tissue?
Cartilage.
Cartilage. And so what, blood is a connective tissue. What kind of connective tissue is that? Is blood.
Collagen.
Say it one more time.
Collagen.
Not really. It's actually probably the easiest one to remember because blood is a fluid.
Fluid.
Yep, blood is a fluid connective tissue. Then we have, bear with me, I'm actually going to come back up here and look for a second. I remember.
It's the elastic connective tissues, right?
What is the elastic connective tissue?
The one that you were saying that has to do with blood and,
No, that's fluid.
oh, fluid, sorry.
Oh, it's all right. It's all right. So dense regular connective tissue, dense irregular connective tissue. These are connective tissue proper. We have reticular connective tissue. Remember that if you think about reticular is a net. These are filtering tissues, like your spleen where you filter red blood cells and white blood cells. Your liver where you filter blood. Where else? Your lymph nodes. Adipose tissue. Areolar tissue. These are all connective tissue propers. Reticular, areolar, and adipose are connective tissue proper. Dense regular connective tissue, dense irregular connective tissue, and elastic connective tissue are elastic connective tissue proper. So you have loose connective tissues with connective tissue propers, you have loose connective tissues, and you have dense connective tissues. The areolar is the stuff that's underneath your skin. You have your skin, your epidermis, your dermis, and then underneath it you have a hypodermis, and that's areolar connective tissue. It also surrounds your organs. If you think about it, if you've ever cooked meat, you cook meat, and if you're like me, I don't like the stringy stuff on chicken. And I just don't like the stringy stuff. So I kind of pull it off, and it's right off the lining of the muscle or the meat. Have you done this where you kind of pulled it off? That's areolar connective tissue. It's very loose and it just kind of pulls off. Adipose fat, reticular is filtering tissues. Dense regular, find it in your tendons and your ligaments because they tend to be really strong. Dense irregular tends to be very strong but have no real consistent pattern to it. Dead elastic connective tissue found in the walls of arteries. We'll talk about not so much this semester, next semester. Your big arteries right next to your heart. tend to have a lot of elastic because of the pulse, the blood pressure coming directly off the heart as the blood comes out. Those vessels have to be able to, you know, expand, and then they recoil a little bit and push the blood forward. Questions? So starting into parts C and D, muscle tissue. Individual muscle cells are muscle fibers. So a way that we talk about muscle cells, we call them muscle fibers. When they're stimulated by the nervous system, they shorten. And this result in the shortening or the contraction results in movement. Movement of bones, movement of blood, movement of food, movement of sperm, movement of something. We classify them into three histological types. We have skeletal muscle tissue, we have cardiac muscle tissue, and smooth muscle tissue. If you look here, and I'll expand it out and hopefully it won't just get blurry, but we'll see what happens. Okay. Now, how do I get it? So if you look here, there's the three different types: skeletal, cardiac, and smooth. What are some strong distinctions that you see just between the three when they're right up against one another?
Like the pattern,
Say it one more time.
like the pattern, like the way you can see, like the skeletal muscle has those like lines going up and down.
Mhm.
The cardiac has more of like a horizontal looking pattern, and then the smooth muscle is almost like a diagonal or different direction.
So you can't really see it. This is not the best diagram for lining it up, but you'll see it in a minute. You see striations, these lines. You'll also see them in cardiac muscle. But like Christina said, you don't see them here in smooth. This also, it tends, skeletal muscle and cardiac tends to run parallel. But cardiac has a lot more branching to it. So skeletal muscle tissue, the muscle fibers, remember muscle cells, muscle fibers, same, synonymous, are cylindrical and long. Some are as long as the whole muscle. So you have a lot of your, you think about the length of your biceps muscle right here. You have muscle cells there that are the full length of the muscle, going from your shoulder down to your elbow. They're multinucleated, meaning that they have multiple nuclei per cell. And they're striated, and it's voluntarily controlled. So it's got a striped internal appearance, and it's voluntarily controlled. This is something that you have to think about for it to contract. The other two, smooth muscles sometimes can be voluntarily controlled. But cardiac is always involuntary. Skeletal muscles attach to the bones of the skeleton and sometimes the skin. A lot of your facial muscles that allow you to do really funny facial expressions when you decide to do them. Those muscles, the one that elevates your eyebrows, is attached to the skin right underneath your eyebrows. Skeletal muscle tissue with long cylindrical fibers, striated, parallel, and unbranched. And like Christina said, you see a lot of striations in it. And it's multinucleated. You have here's one cell, and look at all the nuclei, all the little purple in here. Those are all nuclei. And the reason that there's nuclei within the cell is because muscle fibers are made from the fusion of multiple premature muscle cells. So they all have a nucleus. So when it comes together, the whole muscle fiber has lots of nuclei.
Did you say mature muscle cells or premature muscle cells?
They're called myocytes, and so each muscle fiber is the result of a fusion of multiple premature muscle cells, which I think they're called myocytes. And that is why the cells contain a lot of nuclei. And one thing we'll talk about later is you're born with all the muscle cells you'll ever have. And we'll talk at the very end of the semester, we'll talk about how do your muscles get bigger if you're born with all the muscle cells you'll ever have. Cardiac muscle tissue, only found in the walls of the heart. And the muscle within the walls of the heart is the major layer of muscle is the myocardium. Myo means muscle. Anytime you see the word myo, that means muscle. So myocardium is heart muscle. These cells, like Christina said, are branched. They're Y-shaped because they're branching all the time. And they're shorter than skeletal fibers, muscle cells. They're also striated and they're involuntarily controlled. And if you remember from the other day, we talked about gap junctions from last week. What are gap junctions?
Aren't they like little gateways that open and close for, signals or food or like passageways, right? They're like gateways.
Yeah, they're, let's put it this way, they're tunnels. And where they kind of like a gateway, but it's an always open gate. And it allows for the rapid passage of electrical current by the transfer of ions from one cell to the next during each heartbeat, allowing all the heart muscle to contract and relax at one time. Without it, you deal with almost a fibrillation state. Contraction causes the movement of blood. So the muscles are short, striated, and branched, and they have intercalated discs, which are made of gap junctions. at the junctions between the cells. The one way that I can always distinguish cardiac muscle from skeletal muscle are these little things. These are the intercalated discs. If I see that, I know that it's cardiac muscle, because cardiac muscle is the only one that has intercalated discs. So striations, nuclei, intercalated discs. Yeah, I will tell you that when I look at histology slides, this is the easiest one for me to identify, and it's because of these intercalated discs here. So smooth muscle, found in the walls of most internal organs. Examples: the stomach, the intestines, the urinary bladder. Cells are relatively short and they're wide in the middle and they're tapered at the end. So they're kind of spindle formed or fusiform. Is also what it means to be spindle shaped. And most smooth muscle, it says that it's involuntary. You can adjust some of your smooth muscle, but the majority of it is involuntarily controlled. Consciously, you can adjust some of it, but most of it is involuntary. Contraction causes the movement of food, blood, and sperm. So this is also one thing that it doesn't say here. Smooth muscle is what you find in the vessels, the blood vessels. Don't find skeletal muscle and you don't find cardiac, but you find smooth muscle. So cells are fusiform, they're short, and they're non-striated. So if it doesn't have striations in it, but you know it's a form of muscle, it has to be smooth. Down here is actually a section through the gastrointestinal tract. And the reason I know that is because there's an inner circular layer that actually circles it like this. If I have a tube like this, like your gastrointestinal tract, there's one layer that goes like this, and the longitudinal layer goes like this. You also have this same idea of the smooth muscle. You have this same thing in your urogenital tract, in your ureters and your bladder, where you have two different layers. You have it in your stomach, you have it in your GI tract, you have it in your urinary systems with the ureters and the bladder. So here's just a comparison. This is a better poster than some of those that I had earlier. But you can see the striations that you see in both the cardiac and the skeletal. And they're lacking in the smooth. So nervous tissue. Any questions about muscle before we go into nervous? Nervous tissue contains two types of cells. We have neurons, nerve cells that are capable of initiating and conducting electrical activity throughout the body. And glial cells, which are cells that support and protect neurons. The function of glial cells is partly to support, protect, but we're realizing they have other functions. They can coordinate the activities between neurons. So the major thing when we start talking about the nervous system, about the middle of the semester, we talk a lot about neurons, but we realize that the glial cells are a major player also, and that they can regulate how well a nerve cell initiates or conducts an electrical activity, and whether it does. They also, another type of glial cell has an immune function, so they protect, and partly in their protection functions is there's an immune function. One of the glial cells has its ability to get rid of pathogens that could be within the nervous tissue. So the main functions of nervous tissue is communication and control of body functions. It's found in the brain, the spinal cord, and the nerves. The neurons contain cells processes called axons and dendrites. The axons are the way that they send a signal to another neuron, and the dendrites are the way they receive signals from other neurons. As a general rule, they can receive signals sometimes on their axons, but the dendrites tend to be particularly for receiving signals. So if you look here, here's our neuron, here's the cell body, here's probably the main axon. We won't ever make you determine exactly where the axon is, but here's the axon. This one may have two axons because that looks like it's actually pretty big there. So it could be a bipolar neuron. And all of these little purple cells are glial cells. We also call glial cells neuroglia. And so I'm trying to remember, for every one neuron you have about 50 glial cells. Neurons never reproduce. That's another one that you're most often born with all you're ever going to have. Glial cells reproduce. If you think about cancers, what does that mean? What's cancer? By definition, what is it? Any ideas?
Any cell that is dividing uncontrollably.
Any cell, yeah, any cell divided uncontrollably. So why do you think you don't see cancers of neurons, but you see them of glial cells?
Because the neurons don't have like the machinery to even get to that point.
Yeah, they're not going to replicate ever. So that's the reason you see gliomas, nervous system cancers, but you don't see cancers of the neurons. So here's the nucleus. This is the cell body, or the soma. It's all called the soma, S-O-M-A. Here's the nucleus. Here are the dendrites. The more dendrites a given neuron has, the more sensitive that neuron is, and the more abilities it has to take on more information and take in more information and determine what it's going to do. And I will tell you, having grown up being hearing impaired, your neurons are very plastic in their ability to put out dendrites and retract them when they're not being stimulated over a long period of time. Because when I got my first hearing aid, I've been hearing impaired. It was diagnosed when I was 18 months old. And I compensated so well that my parents did not realize just how hearing impaired I was. And I learned 2 foreign languages. The second one was a lot harder for me to learn because I was not book learning. I was learning by submersion. When I told you that I lived in a foreign country at the beginning of class, when I lived in Japan for 17 months, I was over there. I'd had some book learning before I went over there. But I got over there, and at that point, I had to learn almost completely by hearing people. And guess what? That doesn't work so well when you're hearing impaired. And I still picked it up, and I did all right, but I can say that I was never as good as some of the people I was with, or most of the 90. I was in the very lowest percentile for how well I did. But when I got home, so that was about, I don't know, how long ago was that? 27 years ago. So I got home, and about 15 years ago, I got my first hearing aid. And that's when we learned, honestly, how hearing impaired I was. And the guy that I worked with, he said, you will start wearing this hearing aid. And he said, and you will get to the point of where you will hear better without it than you ever did before without a hearing aid. And then gradually, if you don't wear it over a long period of time, your hearing level, your hearing ability will go down. And I know that, you know, I haven't lived around my family. I said I moved out to the East Coast 3 years ago. Part of that was for job opportunities, and another part of that was for my family, because I just hadn't lived near them for a long period. My mom and I have only been living together for the last 2 years. And they're amazed how well I hear without a hearing aid. I'm not wearing one right now, and it doesn't really help me sometimes, but because I live right next to a busy road and I get easily distracted by loud noises, I don't wear one when I'm teaching online. But I can just say that it's amazing how the more you stimulate a nerve, how much more sensitive it becomes. And the way that it becomes more sensitive is through these dendrites and these feelers that are being put out. Questions? So tissue change and aging.
I have a
Tish,
quick question.
go ahead.
The difference between the dendrites and the, I mean, I understand that the difference in function. What's a quick way to tell them apart? Is the axon?
The axon tends to be a lot bigger. You know what? Let me address that question in just a few minutes, and let me look at some of your homework assignment. I honestly, I cannot remember if there's one where they expect you to be able to look at a histological site and determine what's a dendrite and what's an axon. Because most of the time we don't. Their functions are very different. One sends a signal and it's specialized for sending a signal. One is specialized for receiving them. But let me, because we're gonna have time, let me look at some of your Wiley things, and if they're really weird, I'll give you the answers.
Thank you.
You're welcome. So tissue change and aging. Tissues can undergo a change in form, size, or number during the aging process. A metaplasia. Meta, if you think about metamorphosis, how butterflies metamorphize, they become something else. Metaplasia meaning that cells become different cells. So the epithelial lining of the respiratory airways of people who smoke changes to pseudostratified ciliated, and then to stratified squamous as a protective response. This is usually, metaplasia is oftentimes a major trigger for cancers. Because when cells start having to become different cells to protect themselves, that's a high risk for cancer. Another thing, if you're like me, you tend to be a high soda drinker. I'm not so much, I drink sodas, but I drink a lot of energy drinks more than anything. And have you ever put that soda in your mouth? The first time you've ever opened a soda, you put it in your mouth and you feel it burn the back of your throat?
Yes, I love it.
You love it. Well, it's actually, it really is burning the tissue. And people who tend to drink a lot of soda are at high risk for esophageal cancers later. Or maybe not high risk, but it increases their risk drastically.
Don't say that.
I know. I won't tell you how much soda I drink. So it's important to know the risks. I have a good friend who, I don't have anything against smokers, because I have a good friend who knows everything about smoking. And she knows more than I will ever know about smoking. And she has never been able to quit. And I know that it's a hard addiction, so I don't give her any grief. But the more you know about it, knowledge is power. Hypertrophy. Think of trophy as being number of cells or size. No, let me say this differently. Think of trophy as being size. So hypertrophy is an increase in size of existing cells. Plasia is number. So if you think metaplasia is a change in the overall number from one type of cell to another type of cell. Hyperplasia is an increase in the number of cells in a tissue.
I had a quick question.
Oh.
So I work as a medical assistant, and just the other day I had to do an EKG on a patient.
Wow.
And on the EKG it came out she had hypertrophy. And I was wondering, like, wouldn't it have came up like cardiomegaly, like if her heart was bigger? I know it's like, I just don't see how the EKG picked up that she had hypertrophy, how it could sense the cells.
I think it might, I'm not an EKG specialist.
So I do EKGs. I'm a cardiac monitor tech. So on your EKG strip, like if you look at the EKG strip, there's a bunch of boxes, and each box symbolizes like a set time, like 0.4 seconds each time, which is about your average heart rate, your heartbeats. So what they do, so like what the text will do is they'll interpret the text, like they'll interpret the heart rate, the heartbeat, like if a person's tachy, brachy, stuff like that, and then they'll send it to the doctor with their interpretations, and that's how the doctor will do that as well.
But how do they sense that the heart muscle is enlarging? What I think it might be, and this
So,
is, well, okay, go tell me what you think it is. How do they know it's
So-
actually enlarging when you're looking at the electrical conduction?
if from what I remember from the training, it's been a while since I've been in training. It depends on the size of like it depends on the reading of the EKG strip. Like if it's like,
Does it depend on the size of the waves?
yeah, it depends on the size of the waves, like the QRS complex, the T wave, the Q wave, like it depends on that. And then a lot of times what they'll do is if they've noticed that, you know, the QRS complex, which is like the spiky part of the EKG, if they notice that that spiky part of the EKG is larger than normal, then they'll like undergo additional testing with another cardiac tech.
So I'm looking at one. This is a general ECG.
Yeah. So if you just pull up
Pulling up
one.
this one.
So basically those little boxes, they symbolize the time, which is about, this looks like to be about a 30-second strip. So
Right.
like each of these little boxes signify something. And then you see like there's little bumps, and then there's, you know, there's a big spike, and then there's other bumps. What they do is they count the time of those bumps, and they count the width of how long how long that spike is, how wide it is,
Yeah.
and also how tall it is.
Let me say something really quick, because you know more about reading it. I know more about how it happens. It has to do with the fact that if you think of it as you're measuring the amount of time between when a signal is transmitted to when it's received. The longer that wire gets, even though it's really fast, the longer that wire gets, the longer it's going to take to transmit that signal. And so the waves, looking at a typical ECG, and this is next semester, because this is what Zena gets to see. She saw a little bit this last week, but she gets to see a lot more in a week. Let me go with a typical ECG, and let's find one that isn't like that. So right here, this is where the atria, the signal is being sent through the atria. This is where the signal is being sent into the ventricles. This is where it's being released from the ventricles. If for some reason one of these waves was exceptionally big, or this peak where that Lauren was saying was exceptionally high, that says that signal, it's taking a lot longer for that signal to be transmitted.
I usually just notate it on my recording, and then I send it over to the nurse to double check.
Right.
And then usually, like if the nurse says, oh, yep, you're right, it is a little bit higher than normal, let's notify someone and try to figure out
Right.
what's going on.
Right. So, I mean, if you lengthen out how fast, how long, or how long the signal has to be conducted through a length of muscle, those waves are going to be bigger.
So I was reading that with her question about how can you tell that with an EKG or like an ECG, if the myocardium is hypertrophied, there's a larger mass of myocardium for electrical activation to pass through.
Right.
Is how they can tell from that kind of test.
So there's more length. It's usually more length. Yeah. Okay. So I was right. I had general idea, but yes. So it just, there's more muscle and it takes longer to conduct through a longer, bigger muscle. Hypertrophy is not always bad. It's bad under certain conditions. If you look at some of our top athletes who have a resting heart rate of 40, a lot of times they have enlarged hearts because that's part of what the heart does to get your heart rate down to 40 and allow you to have a resting heart rate of 40. That I think that Michael Jordan had a resting heart rate of 40 at one point. But oftentimes it also means, depending on what's going on and what caused it, sometimes it can mean that your heart is having to work. It's trying to build up muscle to contract harder because you're not contracting enough. It's not contracting enough to move the blood well enough right now. So it's building up muscle, and it's usually, it's a sign that your heart is possibly going to fail. Questions? And the rest of this, I'm going to, more about ECGs, I'm going to make you wait until next semester, because Zena in about a week and a half will be able to tell you all about it. Right, Zena?
Hopefully.
Or in my case, tomorrow morning.
Look. All right. Where was I? I don't know. Let me go back. And actually, I'm just going to do it right now because it's good. So this is the last slide. So hyperplasia is the increase in the number. Hypertrophy is the increase in size. Neoplasia is an out of control growth that's ultimately going to form a tumor. Atrophy, remember, trophy means size, so atrophy meaning a shrinkage, and it can mean size or number. If muscles atrophy when they stop being used, they don't die. Unless you lose all conduction to them, they don't die. But they shrink in size. And so other questions, if you have questions about more ECGs that we may or may not be able to answer, or we'll just let Lauren answer them.
Tissue death is necrosis, right?
Most often. It depends on, there's necrosis would be tissue death. There's also programmed tissue death, which is apoptosis. Necrosis oftentimes is based on a trauma, I think.
Wouldn't
Actually,
an infection also cause necrosis as well?
not unless it's dying. I'm gonna do something really quick because this is one of those where I probably knew at one point, and if my mother was here, she'd be able to tell me immediately. But
I know, like, when I was growing up in Florida, we always had to be careful where we were swimming at because the bacteria in the water that could cause necrosis. But I wasn't sure if that's still the same. Like
there
thing.
is stuff in water. If you think about it, a really nasty spider bite, what are they called? Brown recluse spiders?
Brown recluse. I've seen a few spider bites up close and they are nasty.
They're nasty because they cause tissue death, and that's necrotic. So it says here, the main difference between apoptosis and necrosis is that apoptosis is a predefined cell suicide, where the cell actively destroys itself. It's a planned thing. Necrosis is accidental cell death, so usually due to some uncontrolled external factors like trauma in the external environment of the cell. Other questions?
The reason I was asking is because I work in a radiation oncology clinic, and usually when we hit a tumor with cancer, or sorry, with radiation, when the cancer starts to die, the tissue is described as necrotic, and it usually smells pretty bad.
Ew. There's a reason I'm not in the healthcare. Which makes sense if you think about this. If it's necrotic, it's due to some uncontrolled external factors. I hadn't thought about that. I didn't realize that. I learn something all the time. Other questions?
To kind of piggyback off of that question, so this is kind of about like a general question you might know, you might not know the answer.
You know, Laura, you're asking a lot of questions I don't know, but go ahead and say what it is.
If someone is on like assistance, but like let's say their organ is dying and you know they're on some type of treatment, like when they treat the dying, or like can they treat a dying organ with like antibiotics, or
not if it's not a bacterial infection. And it also depends on how badly is it dying, when do you catch it? Your liver is an amazing organ at regenerating itself. I studied it for a little while. However, you can't live without one. And that's why people who get liver failure, unless they get a transplant, are not going to survive it. I think, and it depends on how vital is that organ and what caused it. If it was a bacterial infection, you may be able to treat it as long as it doesn't get too bad. But sometimes a lot of your viral infections, you go in for a cold and the doctor puts you on an antibiotic. Go into a doctor to see him about a cold and he puts you on an antibiotic. He's not doing the wrong thing, because chances are a viral infection of the cold causes secondary infection of pneumonia, or you may be struggling with walking pneumonia, which is bacterial. But I think a lot of times it depends on your organ and how well can it regenerate if it's failing. Other questions that we may or may not be able to answer?
Okay, so I don't want to distract us any further, but
No, it's
With-
all right. These
with
are good questions. We're learning something.
with apoptosis, when and where, why would a cell actively destroy itself before like a normal life cycle? Like when would that occur?
What? Let me give you a
Self-suicide.
really great example. Have you ever played with a piece of ribbon with a cat and watched them try to grab the ribbon? How well do they do it? Hold on, and how well can they hold on to it? How well do they hold on to that ribbon when you start dangling it in front of them and you put it right where they can get it in their paws? How well do they actually hold on to the thing?
Usually not well.
And the reason is because we have apoptosis that occurs between our digits and separates them before we're born. Cats don't have that. That's why I have amazing dexterity. You have apoptosis between the individual phalanges that allows them to separate. Other times you want to be able to, there's always cells get old. And so they need to die so that they can be replaced, or we'd be a lot bigger than we actually are as people. But most often, like Max said, I'm sorry, David is the first name on there. Like Max said, it's most often it's a controlled thing. Cells get hypoxic for some, at one thing, and it might, part of it may be necrotic. If Max, when you talk with someone who's an oncologist, ask them how much anti-angiogenic therapy goes into cancer research. Because I used to study angiogenesis, which is, if you remember what Genesis means creation. Angio meaning the development of vessels from pre-existing vessels. And if you can block blood vessel development to a tumor, you can block growth of that tumor. And whether it dies because of apoptosis or whether it dies because of necrotic, because it's hypoxic, I don't know. I'm guessing that it just can't keep dividing because there's no way to get nutrients in. So I think your cells, you're constantly having cells that, another thing, in the immune system, it's determined or hypothesized that we develop cancers all the time. We have abnormal growths all the time. Within the period that we're in class, someone is developing an abnormal growth. But your immune system can find those cells and force them to undergo apoptosis and die. And that's the reason we don't develop tumors. And that will happen about this same time next semester for you in 122, when you'll spend time talking about how the immune system surveys for cancer. Viral infected cells, same thing. Cells of your immune system, give them a signal that forces them to undergo apoptosis. So it's a pretty regular occurrence, and it depends on the situation. Other questions that we may or may not be able to answer? let's
Oh,
go.
I was gonna say, I do have a question about the neurocells, the neurons.
Yeah,
You said that they don't regenerate, correct?
most often they don't.
So would you consider like, so would it be considered like, if a doctor or if, someone notices a rapid decrease in the amount of neurons or neural cells, could that be like a symptom of like Alzheimer's or?
It's usually Alzheimer's is gonna be death. It's gonna be atrophy. If there's an increase, it's usually a glioma. Almost always they don't change in size and they don't tend to change in number. I can tell you there are cases. I have some good friends who have a little boy who sustained, right after he was born, sustained 2 hemorrhagic strokes as a result of an accident that happened in the nursery. And so someone did something that was never reported, but for how he was born cesarean, and within 12 hours, he started going into seizures and had 2 hemorrhagic strokes. And when they went in, they realized that he had sustained a skull fracture. And he was born cesarean. And so, even though most vaginal births don't produce skull fractures, cesareans, if vaginal births can't produce skull fractures, cesareans can't either. And what they think is that my mom says someone could have just bumped his head. It doesn't take much to hurt a new baby. And he was given a 10% chance of survival. And if he did, he would be a vegetable. And he is now, this was just turned, I think he's 10. He just turned 10 and he's not a vegetable. He actually eats, drinks, walks, goes to school. He's actually a pretty amazing mathematician. But my friends his parents are both pharmacists and they live in Arizona and he's their only child. They actually tried for 8 years to have him. And so it was pretty heartbreaking when they realized they were probably going to lose him. But the way that my friend has described it to me is when they look at scans of his brain, there's areas where it is dead. He does struggle with things. But there's tissue that has moved around it and changed and generated, allowing him to be a very, very normal looking kid. He was just recently diagnosed with being epilepsy, which was most likely related to the damage that he sustained. But the fact that he's not a vegetable and he's not dead says something. And I think part of that was because he was a brand new baby. And if you think about how much your brain develops over the first couple of years, you have to have some neuronal development going on there, and they have to be dividing there. He's an amazing little kid. He's actually a very big math genius, but he struggles with autistic issues. He shows signs of being autistic, but it's actually not autism. It's a fact that he's a double hemorrhagic stroke survivor. His mom gets really frustrated when people say, well, my son's autistic and this is how you treat him. And she's like, he's not autistic. But so I think it's not supposed to, but does it happen? It does happen. And we're looking at one thing that a lot of, because technology is getting better, stem cell research is creating new neurons. I have a friend who went to graduate school with him, and he recently had a lymphoma that spread to his brain. And when I talked with my mom about it, she said his chances are pretty nil. But he recently underwent a stem cell therapy, stem cell replacement, and is doing significantly better. And he's a professor at Southern Illinois University or something like that. So I think, we're figuring a lot of things out. Technology is amazing. And I think also, especially new babies are amazing in what they'll overcome.
I had a question.
Okay.
We were speaking about like your friend's son who has epilepsy.
Yeah.
I know it was caused from when he was an infant. When someone is diagnosed with epilepsy and they can't find a cause because all of it's not developed yet, there's still plenty of studies they're trying to figure out
Right.
all of the genes and things like that. What is it possible if they don't have like the MRI doesn't detect anything that they can, like the brain can develop to kind of correct itself?
I wonder, just there's a lot of theories out there. My mom is taking something, and one thing that you kind of saw a little bit, we talked about oxidation reduction the other day, right? She is taking a supplement right now that works as an antioxidant essentially. And it's something that was discovered, and the lady that my mom purchased this from, I'll show you what it is. I'm not trying to sell it with you because I'm not sure just how much I believe in it. My mother's here, so I can say whatever. She's not here, so I can say whatever I want to. I'm not sure just how much I agree with it, but I understand the science behind it. It's this substance right here. It's called the SIA. And what it is they have a redox. What a lot of damage that goes on in the body is caused by oxidative damage. And this is working as a major antioxidant to neutralize free radicals. And she made the comment that they've seen that it's worked very well for epilepsy and has reversed signs of epilepsy. And a man that I'm her husband, this man, the lady's husband, was given 5 to 6 years after metastatic prostate cancer. He's now 15 years later, and he's not showing signs of increased tumor growth. And he's been taking this stuff for a long time. And I think I don't know what I think about this. I understand the science. I think it sounds great, but I want to know just how it works. And specifically, what is it doing? And right now, I just think that I know that oxidative damage is an issue. And how is it treating epilepsy? I don't know. So I want to say that, yes, there's a lot of things that they can do, but I don't know what they do and how they work.
I have a question about stem cells. So I know there's a lot of controversy around stem cell research.
Mm-hmm.
My high school, I remember my high school teacher telling me that stem cells come from unborn babies. Like, that like, what is a stem cell? You mentioned it,
It's
so I was like,
not
oh my god.
always true. It's not always true. We're realizing that that isn't where they're always coming from. One place where they can get stem cells is the umbilical cord. They don't have to destroy a baby to get stem cells. They're bioengineering stem cells at this point. It's not, a lot of times when it comes to that pro-life, pro-choice, I straddle the fence. I don't believe in killing a baby to get stem cells. And I'm really glad that that's not what they have to do. But at this point, they aren't, I don't think that is how they're getting stem cells. I think they're bioengineering them. And another one is umbilical cords. They're getting them from umbilical cords. But you can bioengineer cells that you can transplant into people. If you look up, what is it? Cloning, stem cell cloning. They're bioengineering those. You don't have to destroy a fetus to get cells like that. And I think the more we realize how it's becoming less controversial as the technology gets better, and we're realizing, no, you don't have to be a big fan of abortion to agree with stem cell research. Does that make sense?
Yeah, that makes sense. It's just, I got into my dad and I were talking about it the other day, and I was just like, I'll ask my professor exactly where exactly this comes from.
I want to do something really quick. www.pubmed.gov. Say stem cell. Mesenchymal stem cells. This is another place, and you have these stem cells within your body. Remember what mesenchyme is. That's undifferentiated connective tissue. So let's do this instead. I'm going to say bioengineering.
So basically a stem cell is just basically a blank cell that has nothing to do until your body tells it to have something, to do something.
It's a cell that can become a lot of different things. And there's different levels of stem cells. There's what's called a totipotent stem cell, and it can become anything. And as the stem cells divide and they start getting new signals, they start taking certain paths where they can still become a certain number of cells or a certain range of cells, but they can't become any cell because they've started down a specific path. But if you look right here, bioengineering, building us from a stem cell biology. They do not have to, we're getting stem cells a lot easier now than we were several years ago. What is this? So they say new fundamental discoveries in stem cell biology yielded potentially transformative and regenerative therapeutics. So being able to regenerate things. However, widespread implementation of stem cell derived therapeutics remains sporadic. This was 2018, and realize how quickly this field is growing. Barriers that impede the development of these therapeutics can be linked to our incomplete understanding of how the regulatory networks encode stem cells in their fate in developing into certain complex tissues. So what's required to make a stem cell become a certain type of tissue or a certain type of organ that are ultimately required for restorative function. You have to, if you're going to do that with stem cells, if you're going to use them, you have to figure out what signals are required to get them to develop into a certain type of cell. Bioengineering tools, strategies, and design principles represent core components of stem cell bioengineering. There's different layers of complexity present in stem cell derived systems, from gene networks to addressing existing challenges and advancing regenerative medicine. I want to look one more place. Stem cell recovery or replacement.
The stem cells that you just mentioned before, the mesenchymal stem cells, those are the ones they use for stem cell therapy for COPD. My grandmother a few years ago used to do stem cell therapy for her COPD, and it was the fusion would last like 6 months.
Wow.
And it was supposed to be helpful. Unfortunately to her, it wasn't, but
why wasn't it helpful? Do you know?
She was in later stages of her COPD.
Okay.
And she was a very tiny woman. And when they would take the stem cells, they needed to take it from a fatty area. And my grandmother was just shy of 5 foot and weighed like 95 pounds. She was tiny. So they would take it from like her lower sides of her back.
Okay.
And it was quite a process for her. And she started having pain and reactions from it when they would infuse it back in, because they would take it out, regenerate, and infuse it back in.
Ooh.
So after like 2 or 3 infusions, she had to stop.
Okay. Ouch. These papers right here are looking at generating pluripotent stem cell lines. So being able to reproduce them over and over again. From large numbers of endothelial cells. Think of your endothelium. So the emergence of a pluripotent stem cell technology paves the way to generate large numbers of patient-specific endothelial cells that can be delivered to regenerative medicine in patients. I honestly, I don't know a lot about how they're getting the stem cells, except for I know that they're not, you notice that it's not, the conflict over abortion is still pretty big. But the conflict over stem cell therapy is not as big as it was 10 years ago, or even 15 years ago, which makes me think they're getting them another way. Other questions that I probably can't answer.
I just want to ask this real quick. So did you say axons they take away information to the CNS and then the
Say it one more
dendrite.
time. I'm sorry. Start over, Zena.
Okay. So did you say axons take away,
Axons. Okay.
yeah, take away information to the CNS and then the dendrites bring them back?
So axons are going to take whatever signal that the cell body, the nucleus decides to send out is going to travel along the axon. Signals that are being taken into the cell body are coming through the dendrites of that neuron.
Okay, yep, that's what I thought. Okay, thank you.
Let's take 10 minutes. And oh, you know what? You take 10 minutes and I'm going to look through some of the Wiley exercises and see if they're going to ask you about trying to identify dendrites on real histological slides, because I can't remember that. And is that a cat or a dog, Justin? That's a cat. Oh, how cute. Okay. And there's a dog. Marissa has a dog.
She's my class buddy. She hangs with me every lab, every lecture. She's usually on my lab.
She's learning a lot. Okay. All right. I'm going to look through the Wiley lab exercise and let's take 10 minutes here.
So this is kind of a question, but like, no, it's not, doesn't really pertain to the class really, kind of. Like when you were in your graduate, like when you were doing your graduate studies, like what did you do your graduate studies in?
I had a couple projects because I have 2 masters. My first one, I was looking at doing liver cell cultures and looking at a specific gene that was involved in long chain fatty acid synthesis. And that was my first project. And looking at gene expression of this gene, which was a gene that was involved in the evolutionary development of mammals from vertebrates. My second project was looking at angiogenesis and limb development and looking at connections between limb development and kidney development.
Oh, that's interesting.
Yeah, it was. I learned how to do microsurgery with that one and working with chick embryos. And I'm a big animal person. So I kind of lucked out with this because I was working with chicks that were so little, you know, they were just a couple days in gestation. But I didn't feel very bad by having to kill them. It didn't bother me as badly as having to kill chicks that were almost ready to hatch. And it was really interesting. You know, one of the things, you know, talking about that little boy, that's my friend's little boy, I learned something in those chicks that I could physically block kidney development. I could physically stop it. There's a little tube that runs down the side of the body that when it reaches about where your kidneys are going to form, stops moving and develops into the kidney system. It's called the mesonephric duct. And I could physically stop that from being able to move. And what would happen is it would regenerate itself. And yeah.
Do the chicks have similar anatomy to us?
Oh yeah. Oh yeah.
I was told that it's completely different. Like I grew up in the deep south, and I took an ag class, like, and we had to take care of chickens and stuff. And like I saw like a caricature of, you know, the anatomy of a chicken. So like I never realized that could really like that were so similar that it could be used.
Why did they
for-
tell you it was so different?
I don't know. To be honest,
Was it the same guy who told you they were getting all the stem cells from babies?
no, that's my high school
Okay, good.
biology.
Because
So this is my ag teacher. So like most of my teachers that I had in high school were not certified to teach in the subjects they taught.
ouch.
They had like, yeah, so they had really like, they had their bachelor's degree and they had their teaching certification, but they weren't really knowledgeable. So
Okay.
like, it like a lot of the stuff like they taught me was completely wrong. And then
Oh, that's
like
bad.
and also like the area I grew up in, like the human, like I took like a part of biology was human biology and like how the sexual organs and stuff work.
Right.
Well, I grew up in a very like Christian fundamentalist area.
Yeah.
So they actually at one point the year before I went to my human biology class my sophomore year, they actually ripped out all of the human sexuality, like the pages in the biology textbook about human sexuality.
You know, I straddle the fence a lot about, you know, just Mary Gessel's opinions. I straddle the fence a lot about being pro-life or pro-choice, but I'm all for sex education. I think if you know, like I said earlier, knowledge is power.
Mm-hmm.
And that's kind of important. If you want kids to be protecting themselves more, you need to teach them about it.
Yeah, that was not not even possible there. Like I would see, like when I asked my biology teacher, and she was like, you know, I was like, hey, like because I also grew up in a sheltered household, so like my parents, they weren't really, and my parents aren't healthcare professionals either. They're not scientists, so they never really went into detail about how a baby formed. They just said a man and a woman slept together and the sperm hits the egg and poof, baby.
Poof, it's there.
So like they gave it basically like a very basic rudimentary like explanation. And when I asked my biologist teacher, because I assumed he went to school to like teach this stuff, turns out it was music education. He didn't really explain it like at all. Like not until I went to the local community college did I get a very much more in depth, and I felt like that stunted my education a lot, because it's like not only did that not affect only did that affect my education about the body, but it also affected my education in the allied health field too.
Right.
Because unfortunately, like a lot of like diseases form in the body. So like different parts of the body. Like, and I didn't have really, I knew like the skin was the integumentary system. Like I knew brain was neurology, but like it was very rudimentary, very like third grade. it was horrible.
I just think I've never been a parent, but I do, you know, I value life, and I'm pretty anti-abortion for the most part. But I also am very for teaching our kids about it, because when we don't teach them about it, we're sending them out into the world blind. And that's not, and then you wonder why we have so many issues and why there's so many problems.
I mean,
does that make sense?
Definitely, yeah. Like, I mean, even my gynecologist, like when I would ask her questions, like my OBGYN office, they were very like, I don't want to say prudish, but they were very hesitant to answer questions, you know, like But I mean, it was just,
Why do
I
you-
personally, I
Why
would
do you think,
never,
why do you think they were hesitant with you?
because it's the culture down in Florida where I'm from. Like,
Wow.
like, like I wasn't like I went for my regular checkup, and she's like, I don't even know why you're here. It's like, I'm here for my regular physical, women's physical, and she's like, oh.
Wait, last time I checked, you were 10. Oh, that's bad. I think, you know, that would be kind of obvious. I don't, yeah. I'm
It's
sorry
just-
you went through that.
Okay, I mean, I have like, as I've been going through my college, my college experiences and everything, like I've met a couple of students who are in their PhD programs and who are MD PhDs. So like some of them, one of them is a dental resident. He goes, both of them go to Boston University, and they're working on stem cells, and they're wanting to see if they can use the stem cells to regenerate teeth.
That would be awesome because I'll bet you they can.
Yeah, so they're in like the first stages of the study, like they're like trying to plan it out and everything, and like running computer simulations, and they said it could be possible, but it has to be but it'll take a long time.
Well, you know, in Fort Detrick here in Frederick, Maryland, they're working on regenerating skin.
Oh, that's cool.
And wound healing and regenerating skin, because, well, what do you know, if you're working on an army base, what are they going to be doing? They're going to be working on, a lot of that is battle injuries. Let's let me I'm gonna end our conversation for right now, but you guys come back. Okay, so I found this one, and this is question number 2. This is a dendrite. The longest one here, this is the axon. When it comes to the nucleus of the neuroglial cell, obviously you can't see that, but you know that if it's pointing to something out here, it has to be something to do with neuroglia. And then this is the nucleus of the cell body. So this is question number 2. I'm gonna skip to the next one, maybe. Okay, this is muscle. This is muscle. This is asking about the different types of junctions. So go back and look at the PowerPoint from last week, or the beginning parts of our PowerPoint. Is this cardiac or skeletal? Don't look down here. Is this cardiac or skeletal?
Cardiac.
It's cardiac. The way you don't have to look at this if you can see these little lines. This has to be cardiac. Why did we run into this one again?
Because this is the one where it gets brutal, and you, as everybody was saying about the last one, you have to type it in.
You have to type it in. Okay, let's see here.
So sure you
The
write it
nucleus, let's see, nucleus.
Well, it gets hard because some of these, like that first one, some of them want very, very specific fill in the boxes. And so then we try and be specific on the next one. And that one's just a basic general one. And so it just is constantly deceiving and tricking us.
Oh. are you able to go back? If it's one like this, are you able to go back and get the answers there and type them in here?
Sometimes I honestly was getting to the point where the exercises started taking so long that I just I knew I had the general right answers. And so I guessed it twice and then just looked for the exact words that they were looking for and put them in.
That's what I did, because I would take my best guess and I would have it correct. I just wouldn't have it worded the same way or as specifically as they want it worded. So I would have to hit correct answer to know what they were specifically looking for.
But so they do give you the correct answer. Where do you find that?
You have to make several attempts first, and then it will give you the option.
Okay.
But then you have to go back. I would submit it twice, and after the second time of getting it wrong.
Oh, like that.
Yeah.
He
And so
doesn't
the
like
second
what
time
I
after I
did.
got it wrong, it would then make me go back a whole question before I could re-enter my answers. So I had to get pretty creative, but the labs A and B, I think took me well over 3 hours.
Yeah. You know what, I'm empathetic and I'm not, oh, I see what I made. I put in the neuron and not the cell body. I'm empathetic, but I'm not, because I think part of it, these exercises, because the one student who asked me about how to study, the redundancy of this is instilling it in your head.
That's where I will say part A was so brutal, and sort of doing it the way that I ended up having to do it was really time consuming. But by the time I got to part B, I felt like I was honestly sailing through a big part of it because it was so redundant and repetitive. It made it so much easier when you were given that multiple choice. It was like, oh, well, it's this, obviously. So that did make that part easier.
I agree with him. I felt the same way.
I also
It took
agree.
a long time and I did get it, but the second part I breezed through it because I was like, oh wait, I can recall all these things because it kind of helped teach
Well,
me.
and see, and then when you get into the lab quest, how did you do on the first lab quest? The first lab quest, how did you do? Someone tell me. How did you do?
I did okay. I didn't
When
get
you say you
100.
did, well, when you say you did okay, did you get in the 30s?
I got, hold on. What did I get?
Not that you have to announce your grade in front of the whole entire class, but did you?
I don't care about that.
Did you get
Yeah,
in the
I'm not a
30s?
prideful person in that way. That's a very it's personal to each their own.
Yeah.
Hold on. I got to do. You said for the lab. You said for lab,
The lab
quest.
quest.
Lab quest. I got a 34 out of 35.
And how long did you have to study for it, Kara, before you took it? Outside of doing these lab exercises, how long extra did you study for that before you took it?
Well, if I'm remembering correct, lab quest 1, that was over body parts and things like that.
Right.
I didn't specifically study for that one for very long. I just had flashcards that I kind of looked at every day.
Why don't you see with this next one? Let me know how easy it is for you, because these may be hard, but people are not struggling in the lab quests.
Yeah.
And there are other lab exams. This idea is better than you failing those things that matter a lot more.
Right.
And struggling with those. And so I'm sympathetic, but I'm not at the same time.
No, I can understand that. And I'm not, I don't know if any of us are necessarily asking for sympathy. I think it was just shocking because the first lab quest or the first lab exercises that we did,
right.
I don't know, this one just felt like
it was a lot.
It was in its own category. And even though I have paid attention in class and I looked at all your lectures. I had the book, I had the lab like workbook. I was even looking things up online. Like it was still just I felt like I was like pulling it like
It was
anything I
still a
could.
lot.
Yeah, so that's all. I think we're just trying to give, feedback as
I
far as like
can-
how we felt about it.
I can understand that. Let me know. I think that McGraw-Hill, these histological slides like this, you don't see a lot of these in McGraw-Hill. You just don't see them. Wiley has a lot better cadaver anatomy histology slides. But McGraw-Hill is easier to work with. So there's a toss up between this and that. And I understand what you're saying. I don't think I'm getting the right answer. What am I looking at here? Branches. Let me know how this one is for you. See if I can see another neuron one. Okay. This one is the axon. This is the cell body. What are my options for 2? It's a cell body. And 3 is the nucleus. Remember, this would be a dendrite. This is the nucleus, and this is the axon. So a lot of times you can figure out the difference between the axon and the dendrite by how big it is. In comparison. Let's see. Connexins. What are connexins? We have, I can't remember it. They were there, but we didn't really look at them. Connexins are involved in gap junction formation. If you go back and you look at the gap junction slide, they were made out of connexins. All of the following can pass through except for organelles. Signaling molecules, if you think about it, signaling molecules, how are electrical impulses being moved? They're being moved through ions.
Was this question in A and B as well? I feel like I've already seen
It
this.
was a little bit.
This one in particular was.
Yeah.
Look up the gap junctions. Puts them to binds them to the basement membrane.
Hemidesmosomes.
Listen to you guys. I didn't even say anything. Which of the following allows for communication between cells?
Gap junctions.
The middle layer of the heart, the myocardium, is composed of what?
The cardiac, striated, connective tissue.
So that one right there. Booyah. When you start doing this, if there's a really weird one, bring it up in lecture. You can bring this stuff up in lecture. You saw how easy it was for me to go from even one course site to another course site. It's not that hard. Bring it up. And if the answer is that difficult, I mean, one of it is you can skip it. Do me if the question is really weird, just skip the question. Because I'm going to round up your answers on these. Let's see here. To answer this question, look at the animation. I'm not going to go through the animation. Other questions?
on things like lab questions, I can't remember if you have to do them all in one session.
You don't. You shouldn't have to.
Okay. So we can start and stop.
And you have, someone do me a favor, start it. The lab quest you have to do in one setting, but start this. Have you ever been able to leave and come back to it?
Yeah,
Yes.
you can leave and come back.
The Wiley and the Smart Book, you can leave anywhere and it'll come right back to where you were.
Okay.
Mhm.
Okay.
Okay, thanks. I just get confused sometimes remembering which one, and I get nervous. I'm like, okay,
Yeah.
make sure I have enough time to do the entire, assignment
Mhm.
at once.
I am debating just letting you guys go. Let me look at where we were in lecture, because if it's something that's going to require a lot of intense thought, I think we had a good discussion tonight, but a lot of interesting things. I honestly didn't ever plan on talking about ECGs in here, so that was pretty neat. See where we were. 87. Where are we in the syllabus? That will be a key indicator. Let me do a little bit of this and we will finish it. You're going to find that the next chapter is going to go by a lot faster. And let me do a little bit of it and then we'll end. I'll still let you go early.
Professor Gessel, I was looking at that figure on the axon and nucleus and cell body for the nervous tissue in the lab activity. And I missed when I'm looking in the Wiley lab book, it basically gives me the same question, and I usually try to label it and then I use it to answer the questions, but it gives me 3 bullet points, and I was using those to answer the question, but I had such a hard time with that last lab, the words being exactly correct.
Yeah.
That now I'm nervous. So the first one should be the axon. I think it was question was it 13 maybe?
Yeah.
The second one, is that considered nucleus or nucleus and cell body? Because that's how they have it labeled in the diagram.
I think it was that specific question. It was the nucleus of the neuroglial cell was the answer. And the other one that I had wrong, I put in the nucleus of the neuron, but it wanted the nucleus of the cell body.
Okay, so nucleus, because see, I think in the past I would type in cell body of neuron and it would say I did it wrong.
Yeah.
I learned really fast. I got really nervous in the beginning, but I learned really fast with Wiley. If you have to keep guessing until it gives you the option to get the correct answer, it doesn't affect the points that it gives you.
Okay.
If you have to wait until you can get that correct answer to see exactly how they have it worded. And like I said, usually it was just a word or a way that it wanted it phrased that I couldn't figure out what it specifically wanted. But it doesn't.
Even as simple as putting an S at the end, it didn't
Right.
want the S, or it did want the S.
So it doesn't deduct any points. It doesn't take anything off of your grade or completion if you have to wait for that correct answer and then go back and put in what they're actually looking for.
It just makes you want to hit yourself in the head with a bat.
Exactly.
All right, let's just take a few minutes. We kind of talked about this a little bit before. If it's an exergonic reaction, it's going to release energy. If it's an endergonic reaction, it's going to require energy, or you have to invest in it. Every time you create a bond, you have to, you have to provide the energy to make that bond. If you break it, this one right here, you break it, you'll release energy. So creating it is an endergonic reaction. Releasing it is an exergonic reaction. You can release energy from one reaction and use that energy to drive another reaction. So energy coupling is a key feature of the efficiency of the body's metabolism, where the energy released from an exergonic reaction is used to drive an endergonic reaction. Remember, endergonic meaning energy has to enter the reaction. Summary of the different reactions. So an oxidation reaction, remember that's when you lose electrons. That's an exergonic reaction, in that it's going to give up energy. Decomposition, remember decomposition, you're breaking bonds. Catabolism, talked about cannibalism and catabolism, you're breaking bonds. So all three of those are exergonic reactions. Endergonic reactions, a reduction reaction, being able to gain electrons. Or gain electrons. Synthesis, you're building bonds. So that's got to be an endergonic reaction. You have to give energy to create bonds. And anabolism, because anabolism is the same as a synthesis reaction. If you think about it, to a synthesis reaction, two or more smaller molecules are being combined into a larger molecules. Well, an anabolic reaction is a synthesis reaction, just like it says here. Anabolism is the sum of all synthesis reactions. I told you about my cat who lost a lot of weight really quickly, and who you saw him walk across the front of me really right a minute ago. When your body is in a constant decomposition state, when you're decomposing your muscles, they call it a catabolic state. When the rate of the reactions for breakdown is much greater than the rate that you're building things up. Different factors that influence reaction rate. Any questions about this? Remember, exergonic, you're releasing energy, it's exiting the reaction. Endergonic, it's entering the reaction. Factors that influence reaction rates. Temperature. You increase the temperature, you increase the kinetic energy. And like Max said before, kinetic energy is moving energy. The more things move, the more likely they are to react, because they have to physically come in contact at some point to react. If you increase the concentration, you're more likely to get things to make contact with one another. So you get more successful collisions. The smaller a particle is, the more likely it is to move fast. This is why we can't really pinpoint where an electron is at any given moment, because they're so small and they're moving so fast. And if they're moving really fast, when they collide, you're going to increase the collision force. Catalysts, enzymes, cofactors, and or coenzymes are substances that increase reaction rates without being chemically changed by that reaction. They can keep increasing the rate of a particular reaction, converting reactants into products, and not be changed and keep doing that same reaction over and over again, being unaffected each time by the reaction. I think we should stop right here. I told you I'd still let you leave early. Let's be done right here. I plan that I think you've seen the harder parts of this chapter. We will finish this on Monday and start the next chapter. Guys, have a wonderful weekend, okay?
All right, thank you.
Thank
so
you.
too.
Thank you. Have a good night.
Thank you so much.
Of course.
I just had a quick question to make sure I'm clear.
Go ahead.
Since we did not finish the chapter, then it is not
I
due.
will put it off. When did I, yeah. Let me look at it. What did I have it?
For the quiz,
Yeah, let me,
it's due on the 14th, I think, which is Monday.
I'm gonna push it out a week. Thank you for saying something. Because yeah, every time that happens, we should finish. The cell chapter is gonna go by a lot faster.
Okay.
It's just the chemistry chapter is always a little bit more involved.
Okay. I just
But
want.
yeah, if we don't finish it, that's when you tell me this. If I don't catch on already, you remind me and I'll push it back.
I remember when I asked last time, you told me it's not expected if it's not finished, because I
Right,
was thinking about
right.
getting it. And I know we've been pretty on with labs, so those have all been as like the syllabus has been stating, but I know the lectures have been a little different. So I just want to check.
Yeah. So I'll push double all of them back to the 21st.
Okay. Thank you.
You're welcome, of course.
So you said you're pushing back the chapter 2 quiz, right?
Right.
And then the 2 virtual labs, they open up tomorrow or like tonight at midnight?
They should be open now.
Now, okay, I'll check then.
Give me 1 second. Let me look.
Okay.
I know mine don't open until midnight
They're not
tonight.
open. You know what? Would it be beneficial if I open them right now?
I would say so, just so I could start it before tomorrow.
Okay. Give me 1 second. Let me finish the chapter 2 quiz and I'll open them right. I'll do it right now. I'm surprised I don't know why I didn't open them until, I don't know why I wouldn't have opened them. I think I got my dates mixed up at the beginning of the semester. And that's why I didn't open them when I should have. I will, are they like that every time? Every time you have a virtual lab? That they're not opening until the next, sorry.
I believe that they don't open till midnight. I could be wrong, but last time I checked, that's how it was as well.
Yeah, midnight is what mine usually say.
I'm just gonna change them all right now. Because it's kind of silly that it's not even opening on the day we have lab. I think I thought this was a Tuesday, Thursday class, and it wasn't. When I set up the dates before the semester started.
That would make sense because on the syllabus you had like the actual night of class at midnight when it's technically the night before it's due
Right.
at midnight. So that might be why everything is like opening the next day because you thought it was the opposite.
Well,
day.
I hope, I don't think the Wiley, because normally I'm setting those up a week ahead, and now I've got the dates correct now. But I think I understand why the virtual labs, I don't, yeah, wow. Not the 16th, Mary. Oh, what am I, give me 1 second. 15th. Here. Start date should be after. They will open at. I can't open it. I think it will only let me open it at 9 o'clock. Let me try something. Let's see what it does. 8:45. See if it lets me do that. Yeah, it'll open in just a few minutes. Oh, you know what? If I can do it for 8:45, why can't I do it for 8:40? Just a sec. $8:40. Okay, it should open in just a minute here. And I'll do that for the other one right now. Okay. So they should both open in just a minute. Are there other questions?
No, that was all. Thank you so much.
Of course.
Have a good night.
You too. You
I
too.
sent you an email about parts A and B to.
I think that was the one I just saw. Okay, I see. Yeah. Is this Samantha?
Lauren.
Lauren. You know what? You're coming in as LAM.
Yeah.
Okay.
So Ashley is my middle name. McDonald is my last name.
Okay.
But
well, and it only gives me your initials. Let me see. Did you bear with me? Yeah, you put your name in there. Okay. I don't know why it's you know, some people it gives me their name, but yours it only comes up with your email, which is LAM something or other. But I got it. I'll fix that.
awesome, thank you.
Jennifer, Kira, or Dee, are you here?
Yes, I was also wondering about the reopening of Wiley Lab exercises, the
Which
six.
one?
The chapter 6, A through D, part 1 and 2. I did misunderstand of the syllabus as well.
A through D or A and B, right?
Yes, A and B, yeah.
Okay.
And the 1
Yeah.
and 2.
Why do you think you could do them by next Wednesday night or next Tuesday night?
Yeah, I'll get it done as soon as possible. I just wanted to make sure. And then another question for you. So, how you said it earlier, but is there a way to like go in and view the labs that are already done? Because once you click on it, it marks it as done, and it's so confusing.
I don't know.
It's very confusing for me, and like I'm trying, like, I'm like, oh my God, like,
What, do you want to use them to study or what are you?
I didn't do with the Wiley Lab. Oh no, the Wiley Lab. Like, I just want to know, like, once I do it, I get confused. And like, or once I click in it and I do half, or I go back, try to go back to it, it says it's already completed and I get confused with that. So I was wondering if there's like,
Telling you it's already completed. Give me, I'm gonna
it just
stop.
checks it off.
All right, give me 1 second. I'm gonna stop recording and
Okay.
I'm gonna stop